I'm Dr. Bill Burman. I'm the Director of Public Health at Denver Health, and I work closely with Denver Public Schools in this COVID epidemic. COVID conditions have improved markedly over the past month. Our case rate in around the time of Thanksgiving, late November, was as high as an average of 720 per day in Denver County. We're now down to today 230. So that's a 2/3 reduction in the case rate over the past month or month and a half. There have been similar decreases in the percent of tests that are positive. That's called percent positivity. All of those tell us that we're in a much better shape. We still have higher rates of transmission than we would like, and we're still trying to bring those down. But I think this is a safe time to reopen school with the strategy that DPS is using. That is starting with the youngest children. Younger children really are different when it comes to COVID. First and foremost, they, in every study that I know of, have a lower risk of getting infected. There are studies that suggest that younger children transmit COVID less often. And then finally, younger children clearly have the lowest risk of getting severe health complications from COVID. And then finally, I will say, and perhaps importantly for education, younger children have the most to gain from in-person learning. So I think that those are the reasons that the DPS strategy of starting with the youngest children is sound, and sound at this time. I think the best evidence we have now says that it's more transmissible, and that's really concerning. But not more serious for the individual. So for the individual who gets infected, there doesn't appear, at least yet, to be an increased risk of severe disease or death. And also, there's more work to be done, but the early indications are that it won't be less protected. It won't have less protection from this strain than from other strains by the vaccine. So we think the vaccine will still be effective for it. So it's a concern. It appears to be in part responsible for marked increases in transmission in the United Kingdom. And of course, it has occurred in Colorado. There have been 2 cases in Colorado. It doesn't, we need more data, but it doesn't appear to be widespread yet from the early indications that we have. So it's a concern, but I don't think it needs to change our plan. And I think perhaps most importantly, there's no indication that we need to do something different. We probably just need to do a particularly good job of the DPS-5 to prevent transmission of this strain. We don't need to do something new.
Today is the first day in the last chapter of COVID.
I've been vaccinated. I got my first dose, and I'll have my second dose next Monday as a medical care provider. These are 2 very good vaccines, very similar. They work by similar mechanisms. They both require 2 doses. Both, there's clear evidence that they begin to protect within a week of the first dose. They decrease the risk of COVID, both symptomatic and asymptomatic. So there is early activity. The second dose really produces, like with many vaccines, a stronger and more durable immune response. But there is significant protection from the first dose. I think the COVID vaccine is a factor that's just going to let us bring this pandemic under control. We could control it with the things like the DPS-5 of symptom screening, testing, masking, distancing, hand hygiene, attention to ventilation, avoidance of crowds. But vaccination is just going to be another critical tool that helps us bring this under control in our community. So that's the importance. The more we can vaccinate, the easier it'll become to return to in-person learning. Although I think we can certainly start in-person learning as DPS plans before vaccination is completely accomplished. We we, the entire community, have a responsibility to the schools. And that is, our responsibility is to help control and drive down community transmission, because schools don't drive transmission, but schools are definitely affected by transmission. The higher the community transmission rate, the more problems that causes for schools. So the responsibility of all of us is to prevent transmission so that schools can safely open and remain open. So that means all those classic things: universal masking, distancing, avoiding crowds, paying attention to ventilation, hand hygiene. Nothing new, but critically important.